Good morning, everyone. Welcome to the day two of Healthcare Transformation Summits on this virtual platform. I, Harshal Desai, on behalf of Village Technomedia Private Limited, welcome you all for another amazing day that we are going to witness and attend today at Healthcare Transformation Summit, which is being organized by Elit's Technomedia Private Limited and eHealth Magazine. Most of you must be aware of the fact that eHealth is one of the prominent magazine which is published by Elit's Technomedia Private Limited, and it covers information technology and the use of digital channels and mechanism in the healthcare sector. Today, we have been joined in this panel discussion with very senior officers from Maharashtra and other personalities from healthcare domain. We are also here joined by Mr. Karthik Sharma. He is the Ego Vertical and Healthcare Vertical Head at Elit's Technomedia Private Limited. We have Dr. Vijay Satbir Singh, who is currently working with Maharashtra Real Estate Regulatory Authority as the member. He is he has led the public health department in the state of Maharashtra for a long time as additional chief secretary of Public Health and Welfare Department. We have with us Mr. JP Dwivedi, Chief Information Officer of Rajiv Gandhi Cancer Institute and Research Center, and we have Mr. Gandharv Roy, Chief Operating Officer at Medica Super Specialty Hospital. The subject is rebuilding healthier nation, challenges in dealing with pandemic situation. And before we start it, I will request our legal and healthcare vertical head, Mr. Karthik Sharma, to formally welcome all the panelists. Mr. Karthik Sharma. You are on mute. You are on mute, Mr. Sharma.
Okay, can you hear me?
Yes.
Okay. So thank you, Harshal, and I welcome all the eminent panelists here today. Dr. Vijay Sudhir Singh Saab, JP Dwivedi ji, and Gandharv Roy ji. And now I just want to inform you that it was a wonderful day one at the Healthcare Transformation Summit, and where we had presence of Minister of State Health for Health, Government of India, Shri Ashwini Kumar Chaube ji. We had a presence of Delhi Health Minister Satyendra Jain ji, Meghalaya's Health Minister A.L. Hek ji. They were the guest of honors and chief guest and guest of honors yesterday, respectively. And we had wonderful sessions on medicine accessibility, on digital health, and a great discussion on the National Digital Health Mission, which was being discussed by the senior officials of the National Health Authority and Ministry of Health and Family Welfare. And we had discussions on hospital infrastructure, where top hospital decision makers like this today we have here, they were there. So it was a wonderful discussion, and now we were greatly supported by our partners. I would like to mention here Mylan, which supported us in this to pull off this event. I would like to mention Philips, our partners, Trivector, and NABH. These four partners have been a pillars of this event. So today in this opening session, and again, this opening session is very crucial and important because it is on the major theme of the event of rebuilding healthier nation. So when the session is on a major theme of the event, it becomes crucial in itself. So, and at the same time, we have a vibrant panel here. We have a person who has great and phenomenal experience of government of public health, Dr. Vijay Satbir Singh. We have a young mind here in Mr. Gandharv Roy from a private hospital perspective, and then we have technology perspective from Mr. JP Dwivedi. So I am very sure that this will be a wonderful and interesting discussion to be led by Mr. Harshal Desai, who heads our Maharashtra division and Goa division, and has a prominent experience in writing for healthcare. So we are looking forward to a great and wonderful discussion. Thank you so much. Welcome everybody once again, and welcome all the audience also. Thank you.
Thank you, Karthik Sharma. So here now we'll start our opening session on day two at Healthcare Transformation Summit, and I request Dr. Vijay Satbir Singh, a retired IAS officer of 1984 batch, currently working as member at Maharashtra Real Estate Regulatory Authority, to deliver the opening remark. Dr. Vijay Satbir Singh.
Good morning, friends. Thank you, Harshal. Thank you, Karthik, for your good words and introductory remarks. I think we are going to have a very useful and informative discussion today. And as you have rightly pointed out, this is a very relevant topic today because we are passing through difficult times. You must have seen the headlines of newspapers today. India is going to cross the mark of 3 million COVID cases very soon. And I think we are experiencing one of the worst episodes in the recorded human history. COVID-19 pandemic has generated an atmosphere of extraordinary challenges and uncertainty for everyone all over the world. And we ourselves, we are experiencing it today. Uh, just before we started this discussion, I was told that one of the panel members, he also got infected by this epidemic and he could not join. We are all having personal experience of working with the people who are suffering, and that makes it all the more difficult for us to accept that this is, you know, a very big challenge, not only for us, but also for the communities, for the people around us, and maybe anybody can get infected at any time. I'm sure this discussion would provide fresh insights into this multifaceted problem and help us in developing and reforming our systems to take timely action to mitigate pain and suffering of such outbreaks. Here I would like to refer to a WHO report of February 2018. A panel of WHO experts prepared a report and they prepared a list of diseases which could pose big public health risks. The list included some well recognized threats like Ebola, SARS, Zika, and Rift Valley fever. And it also had a disease which it called disease X. The report gave some hints. The disease could emerge from the animals somewhere in the world where people had encroached on animal habitats. It could spread easily and would be more deadly than the seasonal flu. The transmission might be facilitated through trade and transit networks. Nobody knew at that time what this disease X was. But now, after 2 years, we know what this disease was and how it has spread so fast. And everybody is trying, all the countries are trying to tackle this problem and the threats which it has posed to the entire humanity. This also reminds me of another outbreak which took place in the year 2006 when I was Secretary Health in Maharashtra. That time, there was an outbreak of avian flu or bird flu which took place in Europe, India, and Africa. The virus H5N1 was highly virulent and it carried a mortality rate of 60%. There was a warning that it could kill 150 million people and it was very, very lethal. So we were all worried and we got the reports in February 2016 that some birds had died at a place called Nawapur in Maharashtra. The Animal Husbandry Department tested these birds and found out that it was the disease bird flu or avian flu which caused the deaths. I was in Nagpur at that time and I immediately rushed to Nawapur. It's a remote place in Nandurbar district, which is a tribal district in Maharashtra bordering Gujarat. We took timely action. We immediately created isolation wards in our local hospitals, identified 150 persons who were having flu like symptoms. They were all isolated and they were given treatment. Their samples were sent to the National Institute of Virology, Pune. Referral hospitals were prepared for the likely cases. We adopted a strategy of testing and tracing the contacts, which is very important. And even now, we are using the same strategy. We also procured adequate stocks of antiviral medicines. That time, it was Tamiflu. Along with that, culling of birds also took place. Now, this was very difficult job for us because this was the main industry of the people there. Their livelihood depends upon poultry, and it has an annual turnover. At that time, it had about 30 crores. So, 2.5 lakh birds were killed during 5 days, and it was a very painful exercise. The total economic loss of that taluka was estimated to be around 70 crores. Public transportation system was suspended, and the movement of the people was also stopped. We were successful in stopping the transmission of the disease from the birds to human beings and from one human being to another. This was our main success. We found out that there was ultimately no casualty because of this problem, and this disease could not spread. So there are very important lessons which I think one can learn and which we learned from this outbreak which happened at that time. This was the first outbreak of avian flu in India. Now, what are the challenges and which we encountered and which we find even now in the present pandemic, which is having such a large magnitude affecting all the countries of the world? First challenge is that we are fighting against an invisible enemy. Of course, all the viruses are invisible, but this virus, which is new, it has a behavior which is unknown. A number of persons who are infected with the virus are asymptomatic. Now, this is unlike many other diseases, including bird flu, where the persons who are infected they used to have symptoms. This virus does not have boundaries, national, international. It can spread anywhere. It can spread to any place: schools, shops, hotels, prisons, trains, buses. Spread can spread in all communities. Now, what is important? Important is to have early warning. Early warning system should be there, and we should not ignore the early warnings. After that, we have to prepare ourselves. We should keep ourselves prepared and take timely action. Another important issue is that we must make the public aware about this problem. And that is what we did in Namapur. Immediately, we were able to reach out to the people, inform them the magnitude of this problem, uh, the complexity, and the consequences, and the importance of isolation, staying away from others, quarantine. All that was explained very well to the people, and this was very well appreciated also by them. We have to see that we have facilities available for isolation and treatment of the patients in our hospitals and our health centers. We must have logistical planning, should have beds available, as we find now also while dealing with this pandemic. ICUs must have equipment, ventilators, oxygen supply. In the hospital, we should have COVID wards. Then for the treatment, we should have standard procedures. Now we are preparing SOPs based on our own experience while dealing with this pandemic. Another important issue is the training of medical staff, which is very important. Our doctors, health staff, they also get scared. And now we find that many of them, they are trying to protect themselves at the same time, trying to treat their patients. At times, there is shortage of medicines, shortage of equipment, even PPEs are in shortage, in short supply. Supply chains get disrupted. PPEs, if the doctors wear in hot climates, they also find it very difficult to work. At the same time, we have to another challenge which comes before us is that of vulnerable groups, the elderly people who are above 60. Then the persons with comorbidities, hypertension, obesity, uh, diabetes, heart diseases, etc. Now, while dealing with such a situation and so many issues, what we started was a process of lockdown all over the country. Lockdown was necessary, it slowed down the transmission of the disease. At the same time, we found out that there were many problems which we faced, many hardships which the people, especially the migrant laborers, when they went out to their villages, to their hometowns, they had to face. So there is a trade off between the safety of the people, the security of the people, and the issues relating to their livelihoods. Loss of job also puts us into a vicious cycle of depriving somebody of essential commodities, getting essential commodities, getting access to healthcare, and that in turn, makes everything more difficult for him. So these are, I think, very important issues which we are all facing today and which are relevant while dealing with this pandemic of such a large magnitude. We have to learn from our own experience and also from the best practices which others are following. Now, why some of the countries have been able to control the morbidity and mortality, whereas others could not. We have examples. I often see, the figures of different countries which are available over the public domain. Countries like Singapore and Korea, they have done so well. In Singapore, if you see the number of cases, 56,216 and only 27 deaths. And this is a country which I think presented a very successful model of pandemic management. It tested a large number of cases, reaching out to the people who were suspects, who showed symptoms, and who were their contacts, isolated them very well, and isolated everybody from others who was found to be potentially contagious. Singapore was able to control the pandemic. Similarly, South Korea also deployed the same strategy of mass testing. Here also in Mumbai, we find that we applied similar methods of testing, tracing the contacts, isolating the patients, treating them. And initially, you all know that Mumbai became the epicenter of this pandemic in our country. But with experience and deploying all their resources and using the same strategy which some other countries use successfully, and in our own country, states like Kerala adopted it, we were able to control in slum areas of the city very well. As you know, more than half of the population of the city lives in slums. It's very difficult to control the spread of any disease there. In one room, you will find 10 to 15 people. In a small
Yes.
area like Dharavi's area should be 1 square mile, and you will find 1 million people living there. One toilet being used by 10 to 15 persons a day. So, in such a situation, things are very difficult. Social distancing is not possible, is out of question. You have to reach to all the households, but then the district administration took action, and this model was also appreciated by WHO and other health agencies. So I think these are main
Right.
challenges which we are facing, but at the same time, the crisis also
Yes,
provides
sir.
us opportunities to introduce radical reforms, to realign our priorities, and tweak our
Yeah.
policies in the larger public interest. We should work proactively and collectively
Yeah.
to build a more prosperous, equitable, sustainable, and healthier nation. The aim should be to provide accessible, affordable, and quality healthcare to all, with special consideration for the vulnerable, weaker, and disadvantaged sections of the society. Now, for this, we will have to introduce healthcare reforms, strengthen our healthcare system with emphasis on primary healthcare and also uh, the urban healthcare, which has remained neglected so far. The public
Right.
healthcare system is overstretched and underfunded. And I think we should spend more money, which is at present only 1% of the GDP, should have a relook at our entire system, create facilities for testing and infectious diseases control at our district level and sub district level hospitals. The private doctors, they play a very important role, and we should have public private partnerships. At the same time, I think there should be some regulatory mechanism for the private hospitals to prevent their overcharging and exploitation of the situation. I think the time has come when we should seriously think of implementing Clinical Establishment Act, which was prepared when I was in charge of public health department, and we did a lot of work on that.
Yes, sir.
So, in short, the public health obligations of these hospitals should override their commercial considerations. Mental health care is another very important issue which has got highlighted during this pandemic, and I think it should be taken care of in our overall planning and overall uh, strategy.
Yes, sir. So,
Telemedicine, as we
yeah.
find, has
So,
become so convenient
I would like
for
to
everyone.
request Sarbir Singh, sir, that we will again come back to you, sir, with a question on mental health. And but before we do that, I would like to request other panelists also to share their thought on the subject. And then we will also have a couple of slides from Vijay Sadbir Singh, sir, As we all know, he is quite an experienced administrator. He has been quite an experienced administrator in dealing with such situations. So I hope those slides will definitely help us. So, with your permission, Sadbir Singh sir, may I please request other panelists to also share their thoughts on the subject?
In fact, I would just like to add to whatever you have said. The slides only summarize whatever I've said,
Yes,
and I think
yes,
in the end we can show these slides so that it summarizes our discussion and, in short, says whatever is necessary to be done. Thank you
sure.
so much.
Yes, sir. Thank you so much. So now I'll come to our other panelists, and I'll like to request Mr. Gandharv Roy, who is the Chief Operating Officer at Medica Super Specialty Hospital, to very briefly in 2 minutes, if you can share first your thoughts on the subject on rebuilding nation challenges in dealing with pandemic situation. So if you can briefly in 2 minutes share the challenges, and then I will come to you again with the next question.
Certainly. Again, thank you very much for having me, Herschel. The issue of, or rather, the challenges of dealing with this pandemic situation and rebuilding the nation is something I think that is something we've had to reckon with for a long time, and I think COVID has accelerated that reckoning. In many other parts of the world, technology is being used in a way that is making healthcare more accessible, and it's made healthcare cheaper in many ways, and obviously through, rather, let's say, information technology has made healthcare cheaper, while obviously because of inflation things have gotten more expensive. However, what I want to focus on is the first part, which is what the role IT has played. I think that there is a huge scope for, actually, rather, if we look at the last 30 years, if we look at everything we have access to because of IT, you will actually see it as in certain segments, you will see it as a grand deflation, right? Things have actually gotten much cheaper. People have access to information they never did. They have the ability to connect. I mean, we all now know how the rate at which data is trading, meaning the rate at which data is being purchased. Because of the country's investment in data infrastructure and the ability to transfer large amounts of data and information, we are able to access well, not goods, but services at a much lower rate. So I think that is something that has helped us in almost every field, but has thus far not been able to impact healthcare in a dramatic way. Now, the same way that things like demonetization, which was incredibly painful for the country, but really helped India move towards electronic payments. I think that's something that coronavirus is making us really think about and reconsider with regard to healthcare. So mainly, what I want to talk about is how IT is going to be used going forward to make healthcare more accessible and make healthcare cheaper. Um, the first part is obviously, as you know, teleconsultations have become, well, they're everywhere now. Few people are leaving the house. Few people are choosing to, traverse through the community to go to a doctor. And I think that is absolutely incredible. The government's done a great job in relaxing the initial restrictions that they had on teleconsultations. So now prescriptions that are seen by doctors online are definitely more valid. But besides that, that's on the OPD section of things. There are other verticals. For example, new healthcare startups are starting to attack things like chronic disease management, because of improvement in teleconsultations and telemedicine, uh, or OPD telemedicine. They're able to tackle things like long-term chronic disease management, which will be fantastic. Which is a very long tail kind of phenomenon. I think that'll definitely bear fruit in the next 5 to 10 years. And I think that'll be absolutely fantastic. It'll help people manage chronic kidney disease, diabetes, hypertension, chronic liver disease, the usual gamut. And as Dr. Singh said earlier, it'll most certainly be very relevant in tackling mental health. There are a few startups abroad who have already done a great job with using chronic disease management platforms to tackle mental health. And I think that it's only a matter of time before we see them in India. Obviously, mental health in India has other issues such as social stigma and acceptability. But I think, it's a process, and as we see a government investing in education as well, I think that will come to the fore as well. Finally, one
Right.
thing which is super important, is how, um, is rather the is it so it's a composite problem of the distribution of healthcare professionals, right? I know because I'm in private healthcare, any doctor would prefer to. I mean, I'm in Calcutta, and people prefer to live in Delhi, like at a lower salary, than come to Calcutta at a higher salary. Even the cost of living here, I would say, is much lower. So you can just imagine how hard it is to really get somebody into the interiors of the country. Right? There are obviously specific, very driven, motivated, connected individuals who feel a sense of service and responsibility towards where they may have come from, and they represent very strong power centers in the rural districts. However, they are not that many, right? They're just a handful of people who've chosen to take on that mission. I think that using the platform of data. So I'm using data very very flexibly, and I'm using it very liberally. Um, using connecting them with doctors in centers, in urban centers, which tend to aggregate a lot of professionals, will be incredibly important, because you can now use technology to extend their scope of services. So, for example, we have um, we have an electronic ICU in Bhagalpur, right, which is I think second or third largest cities in Bihar, but normally didn't have an ICU before that. We're thinking of establishing certain ICUs in Deoghar and Munger in Bihar and Jharkhand accordingly, places that never had ICUs before, and the way we are able to provide treatment in these interior parts of the country is incredibly important. As again Dr. Singh said, that we have a need to increase the number of COVID beds. But I would go one step further and say we have a need to increase the number of ICU beds outside of the urban setting. So once we take it into the districts, I think you will see um, superior health outcomes throughout the country, right? So somebody will not have to travel 7 hours to come to a city when they have a need for a primary angioplasty, right? And I think that right now is a really incredible and very interesting time for the country. I think we have all realized the importance of um, investing in data. I think the richest man in the country has, put a lot of money down on his data investment, and I think these fundamental infrastructure investments are just completely going to change the landscape. And I'm very excited for where India is going. I'm very excited for to see how healthcare is going to disseminate, how education is already doing so great. I think through always some sort of private companies such as Byju's, and recently White Hat Junior, which is a programming company which is recently purchased by them. But also, we're going to see a massive deflation in the cost of high quality education, all driven by an expansion in data infrastructure.
Right.
So I think it's a really incredible time, and I think things are going to get much, much, much cheaper
Yes.
for everybody, and which
Yes.
is, for these social services, which are the backbone of a country. I think it's nothing but the best of news.
Right. Right. Thank you so much, Mr. Roy. I would request now JP Dwivedi, how, as a CIO, you are dealing with this pandemic situation at Rajiv Gandhi Cancer Institute of Research Center. If you can share your thoughts in brief, sir. You are on mute. You are mute. You are mute, Dwivedi ji.
Forum. See, certain countries have done very well in response to this pandemic, and some others have not done that well. What made that difference? Even within countries, certain areas have done very well, and certain areas did not put up that great show. So, to my understanding, the difference is made by how we are dealing with this situation. So the countries, the areas that responded to the situation experienced lesser mortality, experienced better management. And the countries or areas who reacted to the situation, they were unprepared. There, the mortality, there, the severity was more, the chaos was much more. Now, how to respond to a situation? So, the response needs a lot of components there. First one is having a strategy in place. With cool head, you see how to deal with this situation, complete in holistic manner. Dr. Singh laid down, I think, a fantastic background showing how the H1N1, SARS, or those pandemics were managed. See, in order to manage, the strategy is one thing. Basic building blocks are another thing. That infrastructure place to deal with the situation, and then whatever scarce resources are there need to be used wisely. So we need a very strong demand management perspective. Now, this early testing, screening, social distancing, segregation, isolation, this all is part of an excellent demand management strategy. We as a country did not understand how this particular virus was going to behave, as nobody understood in the world. So the first wise step was to shut down everything and ensure the distancing as much as possible so that the demand generation is least. And that, I think, we took as a country a step in very right direction. We normally in healthcare segment divide the communicable and non-communicable diseases into two strong buckets, which actually has proven to be false in this particular situation, because the people with comorbidities having non-communicable diseases succumb to this particular problem much more fiercely and much more easily. So we need to manage proactively the non-communicable diseases lifestyle very effectively so that we protect as a nation, our population is protected against the onslaught of such emergencies. Now coming to how we managed it, and taking the perspective from the nation or country to the organization, when we saw this coming, we very first thought of protecting our doctors, our nurses, our people, and then our patients, and ensured enough supply of PPE kits and sanitizers. That is the first step. Then we made sure that enough supply of medicines is there. Generally, we keep 3 weeks of supply. That's a normal standard. But this time, sensing this problem, we ensured that at least 6 weeks of supply was in place. Then we extended the duties of nurses and made 50% nurses take rest, making them from 8 hours or 6 hours to 8 hours to 12 hours, and work extended shifts so that other nurses can take rest for a week. And in case of emergency, they are available. Similarly, we did for our even non-clinical staff also. We made sure that people work longer shifts and half of the team takes rest, or 40% of the team takes rest. We equipped them with technology, gave them the laptops, VPN connections. Whosoever could work from distance, they were enabled and allowed to work from distance. And then finally, coming to the patients, our patients are cancer patients, vulnerable patients. They were afraid of traveling to the hospital. So we were in a hurry to actually give them telemedicine solution. So then there are plenty of solutions available. Those solutions as islands don't really work. We needed a solution that was fully integrated with our hospital information system database and seamlessly works irrespective of whether you are consulting a doctor from your home or you are consulting doctor from the hospital. So we worked with our HIS partner, very quickly rolled out the telemedicine app for the patients, for the doctors, so that the patients can request, they can, even new patients can register over the telemedicine app. And with very minimal intervention, we were able to enable our patients speak with the doctors and minimize the travel. At least if we are able to take care of 20% of the demand, that helps. Getting people quick access, they can take their x-rays, they can take their MRIs, CTs in their local cities rather than traveling here. If taking some intervention is required, then of course that travel is inevitable. So chemotherapy, radiation therapy, or surgery will happen here. Otherwise, for all other routine consultations, we are encouraging very actively, communicating, telling patients not to come here unless absolutely necessary. And that is how I think most of the premier organizations in Delhi and Mumbai and other major cities, they are preparing themselves and their patients to deal with it.
Right, right. Thank you, Mr. Trivedi ji. I would like to now move toward our next question, and I'd like to ask the Chief Operating Officer of Medica Super Specialty Hospital that what are the changes that now you see that should happen in the healthcare domain in terms of diagnostic and infrastructure. What are your thoughts on this in such situations?
Just give me a second. I'm just going to write it down and so I can think about it very comprehensively. So, let me start with let me first start with infrastructure. Right. See, fundamentally, healthcare is about the community, right? And healthcare has two two spheres where there is an immense amount of emphasis being placed. One is in capital, so capital expenditure. So, you're building giant hospitals, getting top of the line equipment, getting, the latest linear accelerator, the latest ECMO, the latest, um, you know, 256 slice CT, XYZ, all of those things, which is fantastic. The second part is our investment in people. And, I think we have plenty of nursing colleges. We have some of the best doctors in the world. Um, and we do churn out a lot of them. However, and this is again a very sort of I haven't gone into extreme depth about um, the legislation behind it, but what I've been feeling as an operating officer, so I feel the pain upfront, is that there is a discrepancy in the nurses and doctors, right? And thing is that we churn out a lot of nurses, we churn out fewer doctors, but this gap in the middle, right? So I think we've started a nurse practitioner program, for example, but because of this gap, we are quite unable to really disseminate healthcare into the districts, or rather allopathic healthcare into the districts, into this like deeper into the country. And that is that's creating a problem because you have nurses who are extremely capable. I would say between you and me, I think some of my senior nurses are more capable than my junior doctors. I feel far more comfortable having them around. However, because of the way the regulation is currently structured, and rightly so, they are unable to make high level, like they are unable to provide care beyond the care, midwifery and nursing care. So, example, they can't prescribe tests, they can't prescribe medication, right? They can't even make fundamental diagnosis legally. So I think that there's a huge emphasis that needs to be placed on making sure that we can get enough people into the markets, into the regions, into the districts, right? Because you have to take a very bottoms up approach. You can have the biggest hospital, you can have the fanciest equipment, but I assure you, most colleges or medical colleges or giant university, private public universities have all this fancy equipment and they barely use it. They might use it once in a while. Um, but that capital expenditure has been made. So, if I look at GDP, if I look at government healthcare spending, I see this really fat number. Not as large as it should be, but I still see a large number. But if I try to divvy that up, if I try to divide it up, a large part of that comes as capex. But where are the people who need to run those machines? The machines aren't going to run themselves, right? Where are the technicians who are going to do that work? Am I training my anesthetist to use extracorporeal membrane oxygenation technology, right? So I think that I think there's a huge emphasis on, we've built so many hospitals, we have so many beds, we've got the latest equipment, Great, that's all fantastic. You need those tools, but you need to build the skill sets to utilize those tools. So, from an infrastructure perspective, I think that the way forward is to train more people, get more people up to scratch, and the second is to use IT, use data to leverage the people who have the most information. For example, see, for surgeons it's entirely very different, right? Because they need to use their hands. But for physicians, right, you need to provide them an IT platform so that they can leverage their knowledge, because their knowledge is their are their tools, right? So if you can leverage their knowledge across the spectrum, and the question we need to ask ourselves is that, would I rather have somebody, in the middle of Madhya Pradesh who requires healthcare and doesn't have access to healthcare? Is that a preferred outcome to having, let's say, a really well trained nurse or midwife who has the ability to prescribe medication for 80% of the conditions, and then can leverage advice and information through somebody who sits, in Chennai, for example, uh, to deliver that high end healthcare when it's required? So we need to have a conversation about what is that marginal benefit that comes from having somebody who's a little less qualified and a little less educated, but who's out there doing good work,
Right.
right? So from an infrastructure perspective, I think that is really important. And diagnostics, I think, just ties into that. Obviously, COVID has required us to pivot. So, you go from like your regular, for example, if I look at, my own test, it's the usual biochemistry, hematology, immunoassays, XYZ. That's what I was doing regularly. And sure, now a large part of my test volume has become RT-PCRs and TrueNats for COVID. But I think that is a more temporary change, right? Even if COVID is here for the next 2-3 years, we have to take a really long term view of healthcare, because the changes I make now in healthcare are unlikely to be seen by the same administration, right? The same government, same planning commission won't may put effects into place here and now, but I'll only see the benefit of that maybe 50 years from now, when my death rate drops, when my infant mortality drops, when my maternal mortality drops, when people are living longer, they're more productive living in their later years. For example, now people, because of advances in healthcare, people are living longer, but what's the quality of life beyond a point, right? People,
Mm.
they're existing longer, but are they living longer? And that is a conversation we need to have as well, because there's an aspect of mental health. There's aspect of aging. There's the new research that's showing that when people have purpose and drive, and there's another common saying I've been hearing these days, which is, you grow old when you retire, you don't retire when you grow old. Which is, again, I'm fairly young, so I know it's very presumptuous of me to say that, but it's something that, it's a conversation that I've been having with my father, who's trying to get older as well, and something that's really coming up. So, we need to look at 2-3 things. We need to look at making people, because people are living longer, they need to have better lives. And as we all know, large parts of healthcare come from, people above the age of, so the percentage of healthcare expenditure is on people who are retired or above the age of 60, 65. So we need to have a conversation about how we can make them healthier, whether that's giving them purpose, whether that's educating them, reskilling them, really learning learning from these deep wells of wisdom.
Right.
So I'm sorry, I just went on a tangent,
Yes.
but I think from a diagnostic perspective, I don't think things are going to change in a dramatic way. Yes, you will have point of care diagnostics, which is very important, but I think infrastructure is just so incredibly important that until we start thinking about making long term infrastructural changes, and not
Mm.
just building a new hospital because that sounds and looks good and you're going to get a couple of votes for that, like hooray, great job. But those hospitals is going to be ruins. There's going to be nothing, nobody there, nobody to operate it. Like, you're going to have like 1,500 beds, of which you're barely able to operate 50, like 2,200.
Yes. Thank
Invest
you.
in people, because that's what's going to move the country forward.
Right, right. So before now, before I go to Dr. Singh again, I'd like to request JP Dwivedi ji. You are a Cancer Institute and Research Center, and patients who are Cancer patients were also, have been probably tested positive for COVID. How this is being dealt within your institute, and what are the remarkable initiatives that you have undertaken to deal with such patients within the hospital? You're on mute, Mr. Devi. You're on mute.
Can you hear me now?
Yes.
So once somebody is diagnosed with COVID, uh, the primary thing is to first deal with this particular problem. Whether cancer patient or non-cancer patient, the only difference is that cancer patients are more vulnerable. So we need to be more watchful of them. We have created separate uh, COVID part, and even there, the cancer patients are in one particular area, and non-cancer patients are in other areas, where this particular area consisting of cancer patients is having much more intensive attention. The nurses are the ratio of the nurses, the doctors' visits, and the care is much more intensive because we know that these patients are vulnerable and situation can become bad to us anytime. So that is the only difference that we are making. And certain patients who are even non-cancer patients, but they have comorbidities, they also need extra care. So the youngsters who are fit and fine is one category, and the patients who need extra care is another category. Cancer patient or non-cancer patient does not really matter in this situation.
Thank you so
Have
much,
I
sir. Yes, you are audible. So, how does this change CIO's role in hospitals? What expertise you CIOs bring in when it comes when we face these situations?
See, CIO's role has been constantly changing for past 10 years. I have been
Yes,
witnessing this. We are not just now the technology support providers. So initially we were technology support providers. Then we became enablers, and now we are the partners. So we actually sit in the strategy formulating table also, because
yes,
you see, in as I said, demand management, we needed patients to stay from consult from home, stay home. We needed a lot of facilities there. Now when we think together along with the management, what more we can do? Maybe we can facilitate patients to even send their samples from their home. So once doctor has written that this particular test is needed, and the patient is in the vicinity, we send somebody to collect the sample. Then we send the medicines also along with the instructions. So not only prescription, but medicines can also go. This can happen in the vicinity. There are a lot of
right.
things that we rather think how we can make things paperless, because paper is another, number one, it is source of infection, and
Yes,
number two, we need to save every single penny. Nobody was giving a damn for paper saving, but now people are very actively talking about the paperless healthcare record, paper saving, even saving the bills also. Rather than giving printed bills, we generate bills electronically, we generate reports electronically, send over to them, give only when there is absolutely necessary. This is one area. And other area, uh, see, technology is very much embedded now in both the diagnosis as well as therapeutic areas. So we are working very closely with our lab, with our radiology department. We take part in evaluating even the diagnostic equipments also, how seamlessly they are connected with our PACS. We are working with teleradiology, telepathology, and very soon a day will come when we do telesurgery also. So IT is inevitable part of every area of the hospital,
right.
and it as vital as a senior surgeon or radiation oncologist.
Yes,
When
indeed.
somebody says that one day when the treatment of cancer will come, it might not come from an oncologist, it might come from an IT professional, because of the complex algorithms that they are able to churn out, data that they are able to process. and give the real visualization what lies in the details,
Yes, in fact, this is a
right?
right thing you have pointed out, sir. We see IT companies which also happen to be banks, and we can see IT companies which will also be treating people. So, thank you for your thought. Now,
Yeah,
before
look
I
at,
come,
sorry, sorry, give me another minute. Look at what
yes, yes,
technology is
please.
doing. Somebody having a potential prostate cancer, what we used to do, we will do an MRI. And after MRI, we will say there is a scaling. So there is a scale 1, 2, 3, 4, 5. Now patient is at the scale 3. Scale 3 means it may be cancer, may not be cancer. So the next course was to do a biopsy of the prostate.
Hmm,
Now, in biopsy, the entire prostate will be destroyed because they actually drill holes in several places. Technology is coming now so close to reading the MRI, doing the texture analysis, that there is no need for the biopsy. Whatever your microscopic examination was going to tell you, that this texture analysis will tell you. So the radiology and pathology are merging together with the help of the technology.
right. Thank you so much, Mr. Dwivedi. I would now request Dr. Singh. Sir, we all are aware that how this pandemic has affected the entire world and how it has impacted a lot on the entire healthcare ecosystem, be it infrastructure, diagnostic, telemedicine, and others. So, you have been the administrator for a long time. What are the policy changes that you would probably suggest when it comes to deal such situations, Dr. Singh?
No, I think it's very interesting. I was listening to this discussion, and it was pointed out that the role of health workers. I think that is very important. We often think that only doctors can take care of all the health issues, which is not true. A number of ailments which are very simple in nature can be taken care of by our nursing staff, by paramedicals, and their role is extremely important. In fact, everybody need not go to the specialist and super specialist, but now it has become a fashion that everybody in the country wants to go, even for cough and cold, wants to visit a super specialist, and that is where the problem is. Our hospitals in the tertiary sector become overcrowded, with the result that a doctor who is a specialist or super specialist is not able to give adequate time to the patients. He has to see 100 patients in 2 hours. So, with the result that he is not able to spend so much of time, and that is why you find so many government hospitals which are overcrowded. And as you know, these are also underfunded. So, with the result that the hospitals are not running efficiently, and at the same time, there is the distribution of doctors and health workers is also skewed, and you will find very few doctors in rural areas, tribal areas. Now, the same problem we are facing, there, that our equipment is lying idle at the district level, sub district level hospitals. We do not have technicians, we do not have radiologists, and with the result that the money becomes wasteful expenditure. So, we have to, think of ways we can put this equipment to use, maybe through public private partnership and several other models like that. So that is extremely important. I mean,
Yes.
we should develop disciplines like family medicine, whereby the people are, they go to their family doctors and need not go to the specialists and super specialists for everything. So that is important. We should also, develop specialties of infectious diseases. Train our health workers in that, in dealing with that. Instead of, now, people will start demanding COVID specialists. So Instead of having specialists, the general physicians, the health workers, they can solve our problems, you know. So that is
Right.
very, very important. And
Right.
another issue is IT. The role of IT is something which I think I've seen very important. I even saw it in our prisons when I was additional chief secretary in Home Department. That the prisoners, many of them, they suffer from mental ailments, and
Yes.
they have problems like anxiety, depression. Then some even go to the extent of committing suicide. So they can be easily connected with the doctors who are working in hospitals outside, in well-known hospitals, and they can be provided teleconsultation. Already we are having, you know, facilities of teleconferencing in our prisons, and also available in several hospitals. So both of these, you know, can be connected. Units can be connected, and similarly in tribal areas, in remote rural areas, the primary health centers can be connected with the referral hospitals, so that the doctors are able to, you know, provide their consultation to the patients who are in those areas, in small villages. So that's becoming very, very important, and solving so many problems. uh, so many patients, they get satisfied using this technology. So IT is playing a very important role.
Yeah, that's really true, sir. That's really true. You talked about spoke about the public-private partnership. I'll just seek all of your opinion from every panelist on one more question, and then we will request Dr. Singh to present the slides in few minutes. So before we do that, sir, you spoke about public-private partnership. How do you think that India should now move ahead with this international collaborations, uh, which can help the country in controlling the COVID or eradicating it completely uh, from here onwards? Dr. Singh.
Yeah, no, you know, in public-private partnership, already we have seen that in Mumbai, there were several hospitals which were acquired by the government for the treatment purpose. And as I gave the example of Dharavi area. So private practitioners were called, and their services were solicited by the government. And because we did not have adequate number of government doctors there, the private doctors helped a lot, and their hospitals also were made available for the patients. There are many ways in which public-private partnership can work. You know, there is a large number of charitable hospitals where they are supposed to treat poor patients free of cost, and certain number of beds are also reserved for that purpose. So it's mandatory for them to provide treatment to these patients free of cost. Another area which can where they can be helped is the health insurance schemes. In state of Maharashtra, already there is a government scheme for the poor people, in which
Yes.
health insurance, you know, is provided to the people who are below poverty line, and many others. So, a large number of private hospitals have also been empaneled for that purpose, and there the uh, patients can go and get the treatment. A number
Yes.
of procedures have been earmarked, and so that is how, you know, this partnership is working. And I think it should be further strengthened, and maybe we can have a system of universal health care,
Mm.
whereby all the people in the country, they can be, you know, given some sort of health insurance or medical assistance, in which they don't have to pay a lot of money, they don't have to spend it. We have to make it affordable healthcare and accessible healthcare. And I think private hospitals can help us a lot in that.
Right.
Similarly,
Right.
the private hospitals also have good infrastructure. They have equipments, they have good doctors, and they can provide quality healthcare. So I think both the government and the private sectors can join hands, and they can work for the benefit of the general public.
Yes, thank you, sir. Thank you so much. I would request now JP Dwivedi to share his thought on international collaboration when it comes to dealing the disease and his closing remark also. In 2 minutes, sir, if you can please share it. Mr. JP Dwivedi.
Certainly, certainly. So these diseases don't really know the national boundaries. They are pervasive and they affect us as well as Americans or Russians or Chinese and everybody.
Yes,
And then see, it is all about matching demand and supply. So whatever research is going on in any particular area should benefit everybody across the globe. These there were problems that technology had solved immensely. Now we are really having the second opinion for our patients from the doctors who are sitting in Jefferson or MD Anderson Institute in America. And there are people in Nepal who are taking second opinion from our consultants. And there has to be a hospital to hospital consultation and hospital to patient consultation. Both ways should be enabled. This way, we actually collaborate, the hospitals collaborate and bring in best. So let us say we need a particular opinion about a case that is relating to endocrinology. Now, if we collaborate best endocrinologists in India, in UK, in America, Germany, wherever they are, and we give best opinion to our patients in a very cost effective manner, I think that is the future and that is how this will go. But before we take a big leap on international collaboration, I think we first consolidate the facilities available inside our country also. We have brilliant
right.
doctors sitting in Mumbai, in Bangalore, in Calcutta, in Delhi, everywhere. And if we
Yes,
kind of create a grid, for example, if you know National Cancer Grid, uh, I think Department of Atomic Energy under the leadership of Tata Memorial Hospital, they created National Cancer Grid. Rajiv Gandhi Cancer Institute is also part of it. People can just call on that grid and take advantage of consulting the best oncologists in the country that is part of that grid. So such grids should be formulated in all other areas like diabetes, like hypertension, best nephrology care, cardiology care. And once we mature this model, I think we should go for international collaborations also.
yes, yes. I would now request Mr. Roy to share his views also very briefly on international collaborations and your closing remark for the session. And after then, we will just have in 2 3 minutes, we will request Dr. Singh to present the slides also. So we need to close this by in next 10 minutes. So, Mr. Roy, Mr. Roy, first you share your views on international collaborations and your closing remark.
Yeah, yeah, sure. Thanks. So, Harshad, I'm just going to apologize in advance. I think my internet is acting up a little
Yeah.
bit. So, but I'll try to be as brief as possible. I think, see, international collaborations are absolutely vital to how we're going to deliver healthcare in this country, right? There are some organizations abroad who did an incredible job in developing great. Let's start with IT. Done a great job in developing algorithms and treatment protocols. They've done a great job in figuring out how to deliver primary healthcare and initial triaging services to the people at a very quick level. So like so they can at least resolve like 80% of the smaller issues people can resolve by themselves through an automatic triaging sort of kind of software. So I
Okay.
think that on an IT front, we must absolutely do it. However, on training, again, it's information, it's service based. Again, we should definitely take help of our friends across the world. However, the one place where I will differ a little bit is on equipment. I think equipment is getting more and more and more expensive. Right, every year we're seeing at least a 5% at the very basic minimum, we're seeing a 5% increase in cost just because of the rupee devaluing, right? Basic macroeconomics, the rupee will devalue 5% against, let's say, at least the dollar on a year on year basis. So that is a basic inflation, and on top of that, you have their increase in costs. So healthcare equipment is going to get more and more and more expensive, and I think at that point, tech transfers are going to be very important. You have a couple of countries and couple of companies in India who have already started to do that. So you have Scanray, for example, who's the poster child for Make in India and health tech, based out of Mysore, and even I think GE Healthineers, I believe is what they're called, have started a Make in India kind of lower cost product.
Hmm.
So I think this is a trend that we're seeing happening, but um, we have to become more self-sufficient when it comes to healthcare technology. Because look, all of us are trying to keep costs low, right? We're trying to keep costs low, but capital expenditure, which is such a huge part of where we put our money, is
Right.
growing at 5% due to currency devaluation, and at least another 1 or 2% at the bare minimum, 1 or 2% because of their own price escalations.
Right. Thank you,
So
sir. Thank
this is
you so
something we need to be very conscious of.
Thank you so much, sir. So, considering the time limit, because the next panel discussion speakers have started joining in here on this link, now I would just request Dr. Singh to please summarize this in next 2-3 minutes, sir, with your slides. I'll request Deepak to bring the slides on the screen. Dr. Singh, I'll request you to summarize it in
Yeah.
about 2-3 minutes, sir.
Thank you, Harshal. Uh, I'd like to say a few things about international cooperation, which
Yes.
the speakers have pointed out. I think now we are in the process of cooperating and collaborating with other countries in the development of vaccine, and that is very important. And uh, once the vaccine develops, every country will like to have it at the earliest, and there also we will require the cooperation and help of the other countries and pharmaceutical companies which are working there and in our own country. Similarly, the new medicines which are being tested and tried uh, will also be supplied by the countries which are having advantage, which are having the availability of those medicines. Like we did, we supplied hydroxychloroquine to USA in the beginning. Similarly, other medicines which are not available in one country can be procured from the country that is having. Uh, Similarly, we are uh, looking forward to cooperating with other countries in developing methods of controlling this pandemic more effectively. Maybe by restricting airline travels, enforcing guidelines on travelers, and there also we require the cooperation of other countries, and we require their help and cooperation.
Yes, sir.
So similarly, the equipment
Hmm.
like ventilators and PPEs, masks. Now we are becoming self-reliant in so many things,
Yes.
manufacturing them. We can supply to those countries which do not have. So these are
Right.
the areas where we can
Yes.
cooperate.
So, sir,
Now,
we are on virtual platform, and the biggest limitation is that the links that we provide to speakers
yeah,
expires after a certain time. This is the challenge that we face. So, I would request you, sir, to please end in next 2 minutes, and
yes, yes.
this will be the
I'll
formal
not.
end of.
Yeah, I will
Yeah.
not take much of the time now. It's just whatever has already been said. It
Yes.
summarizes.
Yes, sir.
Rebuilding the first slide is just
Ah,
uh, the caption of today's discussion: rebuilding healthier nations, challenges in dealing with pandemic situations.
yes.
The second one shows what are different types of infections which are emerging in different ways. We have newly emerging ones, and we have a large number of bacteria and viruses attacking different countries, originating in different countries. Can you see the slides, please?
Yeah, Deepak, will you please put it here, Deepak? We still have just one more minute, Deepak.
This is the second slide.
Yeah. Yes.
Yeah.
Yes, sir.
So it gives a very scary picture. These are three categories of infections, newly emerging infections, and the present pandemic is a part of this category. Earlier we had SARS, we had H5N1, H7N9, and we have now this particular infection that is, and most of these are originating from one country. Now, these are newly emerging threats, mostly viral.
Yes.
Second category is re-emerging and resurging threats. The diseases which were vanishing or which were under control are coming back in different shape. Like we are having tuberculosis, which is drug resistant. We are having malaria, drug resistant malaria. We are having typhoid. We are having diphtheria. So different types of diseases which are coming back. We are witnessing in our countries of the world. And the third category, very few ones, and this is deliberately emerging, where you have anthrax, bioterrorism. So a small category, of course, and where we can control. So it just gives a picture of
Yes,
threats,
sir.
which are there in the world. Next
Yes, sir.
slide is, you know, three stages of our response, recovery, and rebuilding while dealing with the pandemic situations. And the earliest one is response. Then we have recovery when we try to, bring back our economy, our development to the previous level, and rebuilding to face next problem of that nature. So
Right.
these are the stages which are important. We have already discussed.
Hmm.
Next is the role of community strengthening, the local leaders, the community engagement, the participation of the people. This is extremely important, and we should adopt bottom to top approach while dealing with problems of this nature, so that the people get reassured. They are given the entire information regarding the
Yeah.
problem, and
So,
they should participate in all the activities which we undertake. Similarly, the role of hygiene and sanitation we have already discussed and we know very well. And
mhm.
this is true of all the pandemic situations. Very important role and very necessary also. We it also This slide also says something about private sector joining hands with the government, and urban slums and cluster dwellings, which are prone to such types of problems,
Right.
and which
So,
our
Dr. Singh, sir,
strategies should focus on these areas.
we'll have to close it now
Yeah,
because in
the
next,
last one, the last one
yeah,
is health and economic stability. Again, we have already discussed, and
yes,
economic restructuring. Again, I mean, we should have take care effective strategies to create
right.
jobs, and also for economic stability and restructuring. Thank you so
Right.
much.
Thank you, sir. Thank you so much. And I apologize to all of you if because what happens is that we are online and the next panel discussion speakers are already there. So thank you so much. I once again on behalf of Villets would like to present a certificate of participation to Dr. Vijay Satbir Singh, former Additional Chief Secretary, Public Health Department, Government of Maharashtra, to Mr. JP Dwivedi, CIO, Rajiv Gandhi Cancer Institute and Research Center, and to Mr. Gandharv Roy, who is the Chief Operating Officer at Medica Super Specialty Hospital. Thank you so much, Dr. Singh, for taking time out, Mr. Roy and Mr. Dwivedi. Thank you so much for
Thank you.
joining us today. Thank you so much, sir.
Thank
Wonderful
you.
discussion.